So more high blood pressure news. Let's see what I can find here. Since high blood pressure, these meds can make it worse. Let's go to Healthline. See what this is. 1 in 5 people with high blood pressure are taking meds that can make it worse. Not surprising. Nearly 1 in 5 adults have hypertension. Sorry. With hypertension, take medications that can be worsened. Okay, let's see what else I can find in hypertension. News today, we have Healthline. If you have high blood pressure, these meds can make it worse. Yes, 1 in 5 people with high blood pressure are taking meds that can make it worse. Researchers say doctors need to pay more attention to what medications people take. Even simple lifestyle changes like diet and exercise can help drastically improve people's blood pressure level. So there's a little bullet here. Doctors need to pay more attention to what medications people are taking. I spoke with a lady one day, casual conversation. It came up that she had high blood pressure, and we were just kind of chit-chatting. And through our conversation, we learned that it was actually her birth control medication that caused her blood pressure to go up. And then, because she didn't know, because she didn't make the connection, she went to a cardiologist, because her blood pressure went up. The cardiologist gave her, obviously blood pressure medication. And after this discussion, I said, you may need to try to find a birth control that doesn't raise your blood pressure. And it's just as simple as that. And I'm like, the cardiologist wasn't talking to the OBGYN and vice versa. And as a patient, she wasn't aware that you should coordinate and make sure doctors are communicating with each other. Because they cannot guess that you're on medication. You have to tell them. Sometimes as patients, you kind of don't know what to say. But really, especially when you're taking medication, give the doctor as much as a full picture of you and who you are, what you do on a regular day, and what medications you're taking as you can, because they just can't guess. And it's like maybe they might have 15 minutes for you. So go there with a plan and knowing what they need to understand about you. You got this other medication here, you got this high stress job over here, and let them factor all that in before they prescribe you. Nearly 1 in 5 adults with high blood pressure take medication. Okay, they take other medications, let's say, like steroids, NSAIDs, Tylenol, things like that, birth control, and these sometimes they can worsen high blood pressure or worsen your blood pressure level in general. There may be some that that can lower your blood pressure too low. According to new findings, which are present at the American College of Cardiology's 70th annual scientific session, doctors need to pay more attention to what medications people take and how they may affect their blood pressure. These are medications that we commonly take. The NSAIDs, the birth control, antidepressants are becoming more common, over-the-counter medication. So even that, not that you have a prescription, but if you have a habit, you get headaches sometimes, you have a habit of popping Tylenol, your doctor needs to know that too. Half of adults take drugs that elevate their blood pressure. So the study evaluated about 28,000 people who participated in the National Health and Nutrition Examination Survey between 2009 and 2018. About half of the patients, 100%, had hypertension. The researchers identified medications they took that are associated with high blood pressure, such as NSAIDs, steroids, birth control pills, and antipsychotics. Nearly 19% used one or more blood pressure raising medications. Nearly 19% used one or more blood pressure raising medications, and 4% used multiple drugs that are linked to higher blood pressure. The findings also show that stopping use of one of these medications can improve your blood pressure rates by about 5%. Now, how these other drugs, how they affect your blood pressure? NSAIDs, steroids, oral contraceptives, antipsychotics have a clear correlation with the raising blood pressure because they can cause patients to retain fluid, which can lead to an increase in blood pressure. NSAIDs like ibuprofen can raise blood pressure by impacting blood flow to the kidney. Antidepressants can alter chemicals in the brain, which can contribute to hypertension. Steroids can increase blood pressure levels too. Steroids can cause retention of salt and water to increase blood pressure. That's just increasing the volume of blood, which then increases your blood pressure. Okay, we know about 45% of U.S. adults have hypertension, unfortunately. Only 25% have the hypertension under control. Hypertension, when untreated, can cause or increase the risk of cardiovascular disease, heart attack, stroke. One simple thing patients can do to lower blood pressure is to exercise, of course, get in shape. I'll add to that, get a healthier diet, get sleep, and if you're experiencing excessive chronic stress, like that is something to look into immediately. Life is stressful, but it shouldn't be an excess, and it should not be all the time. That leads to high blood pressure. That leads to high blood pressure too, but also leads to maybe depression, anxiety. This is why you get on antipsychotic, but that's added to the problem of the high blood pressure. It's kind of create a cycle. You have to find a way to get out this cycle, and really, you must make different changes, make changes to your lifestyle in order to lower your blood pressure. Providers who prescribe antidepressants, birth control pills, etc., should be aware of their patients' comorbidities and choose a medication with a minimal effect on blood pressure. So there may be alternatives out there. Just give your doctor a chance to look into them. All right? I think that was simple. Don't look at any piece of your health in isolation. Look at your high blood pressure separately, then maybe your migraine or depression, or separately, then your birth control and things like that. It's all part of your one body system. They all impact your body, and you need to communicate with your doctors and let them know what you're doing over here with this doctor, over here with this other doctor, so they can kind of get together and figure out the best regimen for you as a whole person, right?